My name is Stephen Markowitz. Thank you. I'm an occupational medicine physician. You know, it occurs to me from New York, you know, I'm thinking about our friends from Italy, our friends from Brazil, and so many times we've talked about Mount Sinai today. I think you may have the impression that Mount Sinai is the only medical school in the United States. It's not true. There are over 100 medical schools in the United States. But Sinai has played a special role due to Dr. Selikoff, Dr. Frank, and others. I would also say that what I'm going to talk about for the next 10 minutes, I think is a message of hope on the medical front. We don't get that message very often with asbestos-related disease. So let's begin to talk about that. My disclosure. Okay, you know, mesothelioma, if we look at the number of times mesothelioma is mentioned today versus lung cancer, we would think that mesothelioma was the key disease related to asbestos. But in fact, the numbers show in the United States, and I know this is true for Italy, and I know it's true for Brazil. Italy, by the way, has the best mesothelioma surveillance system in the world. But lung cancer outnumbers mesothelioma manyfold. Linda showed some numbers earlier that there were some 30,000 lung cancer deaths in the US. It's a range, but there are about 3,000 who die each year from mesothelioma, and 6 or 30,000 from lung cancer. So lung cancer is an incredibly important outcome. I think a little bit neglected, actually, when we talk about asbestos-related disease. So lung cancer is important not just for people exposed to asbestos, but it's important for everybody. This is general population data, United States, the cancer deaths, number of cancer deaths, the top 5 causes of cancer deaths in the United States, expected this year by the American Cancer Society statistics. And you can see on the left is lung cancer, 127,000 deaths, by far and away more common than the next 4 most common causes of cancer death. So this message about what I want to talk about is screening for lung cancer, important for asbestos exposed, and also important for other people who've been exposed to cigarette smoke or other carcinogens. But when we look at cancer screening, and I'm going to now add the numbers for cancer screening, so hold this as the number of deaths that occur in the US, and now we add the white bars, which is the rate at which we screen for cancer in the United States. And you can see that actually lung cancer may be the leading cause of cancer death, but the white bar is the lowest of the 4 cancers that we screen for. It is the cancer we least screen for in the United States. We do a much better job with breast cancer. 76% of the population of women get screened with mammography for breast cancer. Colon cancer, almost as much, 70%. Even prostate cancer, which frankly is not even recommended for screening, is ahead of lung cancer. Lung cancer, less than 20%. So we need to change that. We need your help to change that. And the reason why lung cancer is so deadly is quite simple. It's usually diagnosed at a late stage, stage 3 or stage 4. And there is some improvement in treatment over the last several years, but not all that much. So that most people who are diagnosed with lung cancer die from lung cancer. We can change that simply by diagnosing it early. We know when we diagnose lung cancer early, and we know this now because we've been doing this work, not just our group, but in general in the United States, Japan, and elsewhere, over the past 20 years, that if you diagnose lung cancer early, 85 or 90% survive. They're cured. They'll live a normal lifespan, as opposed to if they have advanced lung cancer, they will die within a few years. So the question then is, how do we detect people early? And we do that through a simple test, low-dose CT scan. Now, I mentioned our other methods of cancer screening. So this is how we screen for lung cancer. The person comes into the CT scanner. They usually don't even have to take off their shirt. They have to take off some metal. They lay down on the table. The table slides into the scanner. They hold breath for 15 seconds. The table comes out. They get up and they leave. That's the entire procedure for low-dose CT. By the way, low dose, low radiation dose. Contrast that with our more common ways of cancer screening, say colonoscopy. Many people here probably of the age of having had a colonoscopy, and you know it's an unpleasant procedure. Mammography, I'm told, is an unpleasant procedure. Here we have lung cancer screening, very simple. It has to happen every year, very simple and painless. So we've been doing this for the last, since the year 2000 at the nuclear weapons complex across the United States. Tom earlier mentioned Hanford as one of those sites. We've been at many sites. We call it the Worker Health Protection Program. We do it with unions. Arthur runs a similar program at one of the sites, and it's supported by the Department of Energy. This is our CT scanner in Oak Ridge, Tennessee, which is one of the major sites where we built nuclear weapons. Actually, we put it at the Union Hall because I'm from New York. You know, it was free parking, and free parking is very valuable when you're from New York. So we put the scanner at the Union Hall. But more seriously, if you're a union member, you think this is your program if you see the medical facility at your Union Hall. So they own this program. And in fact, it's co-sponsored with the union. So we get very good adherence with our scanning because they own this program. And there's our CT tech, John Lane, and there's that infamous table I was discussing earlier in the earlier right. And this is where we're doing the scanning now across the country: Ohio, Tennessee, Kentucky. A little geography lesson, I'm sorry, but out west as well, in Nevada test site, Idaho, California, and other places. Now, you know, a few doctors have mentioned CT scans, have shown you pictures. Nobody's actually explained to you what a CT scan is. I don't really have much time because Linda never gives me enough time. But I do want to point out, a scan is simply a slice of the lung. Instead of an X-ray where you see the whole lung, a scanner gives you slices, and you look at multiple slices of the lung. So this is a slice of a worker's lung from Nevada test site. On the left was a scan we did in 2019. The red circle shows you an area of the lung which has normal lung. It's just black. That's the way normal lung appears on a CT scan. We scanned them 2 years later on the right, and you see that circle now. In the middle of that black normal lung is a small nodule. That's a lung cancer. That's an early lung cancer. That's a lung cancer that doesn't kill anybody. That's a cancer that Dr. Flores, Dr. Wolf can go in and remove pretty easily, and the person can go home a couple of days later. That's when we talk about early lung cancer detection. And so we've done this for 20 odd years. We've scanned 14,000 people, workers, mostly retired workers. We've detected 209 lung cancers, and this is the key statistic, which 2/3 of those lung cancers have been early stage disease. So about 70% have been stage 1, very small, or stage 2, which is slightly larger. Stage 1 and stage 2 are resectable by surgery, and those people should do well. And yet, our problem is, not in our program, but in general, is how do you convince people to have lung cancer screening? I said before, it's a very simple, straightforward test, right? But people still are not signing up for it. Not clear why. Primary care docs probably aren't on board. Smokers may have some ambivalence about recognizing their risk. But these are the risk factors that you need to know about, both for yourselves, for your family, for your coworkers, for the programs you're involved with. Age 50 and over, history of cigarette smoking, very important. Obviously, exposure to asbestos or other lung carcinogens in the workplace, family history of lung cancer. And so, I'm ending here, Linda. You know, doctors aren't going to ask you about your exposures. The lawyers here can tell you, in their cases, even the mesothelioma surgeons, when you read medical records, and I read them because I review cases and assist in court, and I look at the medical records and I see what do they say about the occupation. This person has mesothelioma. Almost all the cases are caused by asbestos. And do you find any doctor admitting or detecting or reporting that the person had asbestos exposure? And usually not. Usually what you find is occupation, retired. So the fact that they were a firefighter wouldn't be in the medical record. And so you and people who go to see doctors have to tell them yes, I was exposed to asbestos, or I was a carpenter, or I was a firefighter, or the like, so that they will know that there may be exposures. And then you've got to actually demand a low-dose CT scan because it may not occur to the physician. That's my message, that we can now detect, screen for, we can treat, cure lung cancer if it's detected early. And it's our job really to go out and make that happen. Thank you.